Knock knock and hand hygiene. Hello, my name is Sarah. I'm the nurse taking care of you this afternoon. Can you state your name and date of birth for me, please? And we have Casey Banks, 10/2/1965. Casey Banks, 10/2/1965. Do you have any allergies, Casey? And Casey's allergic to aspirin. I do see aspirin as an allergy on your wristband and on your MAR. Okay, Casey, so the reason why I'm here today is they want to do that TB skin test today before you go home. Have you ever had a TB skin test done? And Casey says no. All right, so what I'm going to do is inject a very small needle into your left forearm region on the inner side. And what this is going to do is it's going to place a small amount of the tuberculin antigen in that intradermal tissue. They'll be able to interpret if it's positive or negative within 48 to 72 hours, just depending on the size of the reaction that forms. Do you have a history of TB that you know of or exposure? In case he says no, and he says that he is able to come back to the clinic in that time frame for the test to be read. So there will be a little bit of a wheal or a little blister type lesion at the injection site. I just ask that you not rub or itch or scratch that at all, because that can spread that to deeper tissues and it can lead to an inaccurate test interpretation, okay? Casey says all right. So I'm going to do my third MAR check before we get started with our assessment pieces here. So I have Casey Banks, 10/2/1965, allergy to aspirin. Today we're giving Tubersol, and I have Tubersol intradermal injection. This is for intradermal injection. Today only, dose of 0.1 mLs. This is 0.1 mLs, and I'm verifying on the syringe. We have 0.1 mLs, which we do. Due today at 0700. It has not been given today, and this does not contain aspirin in it, so I'm going to take my syringe out for now. My alcohol wipe is clean, dry, intact. It's not expired. I'm just going to move my equipment around, so I'm getting my gloves on, and I'm going to take a look at your arm here. So for selecting our site, I'm going to go about 3 to 4 inches below the antecubital space, and then 3 to 4 inches above the wrist. And I'm going right in this middle section, so right around here. I'm going to look for any freckles, moles, scars, wounds, any IVs, fistulas, anything that would be considered impaired skin integrity. So I'm going to go right over here. I think that looks good. And I'm actually going to move this around here. So first I'm going to clean the site. Just going to clean 1 inch for 10 times, and then we'll do 2 inches. Okay, there we go. That is clean. I'm going to let that dry. So when we inject, we're going to do the bevel up. Okay. And I'm going to be spreading the skin taut. Okay. And injecting at a 5 to 15 degree angle. All right, Casey, you're going to feel a little bit of a poke. Okay, injecting 1/8 of an inch. And now I'm going to slowly inject. There we go. And typically you'll get a wheal. So I'm waiting 2 to 3 seconds. I'm going to remove at the same angle of insertion. All right, that's done. I'm going to activate my sharps safety on here. That'll go in the sharps container. I'm going to document that we administered this on the left forearm. And it's 0715 SB. All right, Casey, so we're gonna put just a couple dots around that site just to monitor if the redness or reaction spreads. Again, come back within 48 to 72 hours. Avoid scratching, picking, rubbing, massaging that site where we did that injection. Yep, and we're able to come back. So I'm already documented, and I'll give you your call light, have the bed in the lowest position, and lock the bed.